Any other business? Okay. So welcome members of the committee and any members of the public who may be watching online at home in the comfort of their own homes. I'm Councillor Boyd Elliott, I'm the chairman. I'd like to remind members that they need to make sure that they use their microphone so they can be heard on the live stream and by anyone who is joining us in the meeting today. So we move to agenda item 1, which is the minutes of the last meeting of the Adult Social Care and Public Health Committee held on the 24th of January 2022, and ask the committee if the minutes for the last meeting can be agreed. All those in favour? Okay, that's carried. Agenda item 2, apologies for absence. Joe?
Thank you. We've got a number of substitutions today. We have Councillor Anderson substituting for Councillor Moxon, Councillor Creamer substituting for Councillor Welsh, and Councillor Pringle substituting for Councillor Fielding.
Okay. Well, I'd like to welcome all three of you to the committee this morning and pass on our hope your colleagues get well soon. Okay, pass them to Michelle. Okay, agenda item 3, declaration of interest by members and officers. Do any members or officers present have any disclosable pecuniary interest to declare? None. Do any members or officers present have any private interests, either pecuniary or non-pecuniary, to declare? None. If you do come up with anything later on in the meeting, just shout, raise your hand, tell us, and we'll check. Okay. So we go to the first substantive item on the agenda, and that's agenda item 4, which is the Adult Social Care Performance and Financial Position Update for Q3 2021 to 2022. The report provides committee with an update on the department's current financial position to the end of December 2021 and a summary of performance for adult social care and health for Q3, which is detailed in Appendix A. The report highlights that the department is forecasting an underspend, primarily due to reduced spend on ageing well care packages. However, Q4 is seeing an upward trend in this area as more people are coming forward for support. Performance and sickness absence across adult social care and health has been significantly impacted by the Omicron variant, as well as recruitment and retention issues facing the teams. As people wait longer for services, the report highlights our Promoting Independence Workers service and updates the committee on a visit from Lynn Romeo, Chief Social Worker, with some examples shared of strengths-based social care practice and co-production with people with lived experience. I move the recommendations set out on page 6 of the report and ask for a seconder.
Yep, and I'm happy to second and reserve my right to speak.
Thank you very much, Councillor Barney. I'll now open that up. I'll now hand over to Melanie, actually, and Cash, who will present. Okay, thank you.
Morning, committee members. So I just wanted to touch on the financial performance before I ask Cash to comment in more detail on the performance aspect. So I just wanted to draw your attention to the underspend that we're forecasting for this financial year. And for many of you who have been regular attenders, you'll know that we had an issue with, I think, 2 things for older adults. One is seeing less requests for support due to the concerns around COVID. The second is our ability to support people in a timely way. So because of that less spend on older adults packages, for those 2 reasons, we're predicting an underspend. For the eagle-eyed among you would have seen in the budget report that went to full council in February that underspend is being used to fund a contingency pot of money for adult social care for next year. And within the department, we're just working through the different options that would enable us to meet a growing waiting list for adult social care that we're seeing in the department. So that's all I wanted to really comment on in terms of the finance. So Cash, if you'd be so kind as to talk us through the performance report.
Thank you, Mel. Morning, committee, and I'll briefly talk through some of the key elements of the report. In terms of performance, the report sets out adult social care performance across all of the key functions and key areas of adult social care. Clearly, it sets out that we are continue to be challenged in most of those areas, and again, that is the context really is around that we've over the past 6 months we've been in and out of crisis emergency response. We've been in that state of play where we've had significant fragility in the care market. We've had providers hand back packages. What then that means actually is that our internal services have to stop delivering some of the services, business as usual services, in order to respond to that crisis response. And so it's been extremely challenging. In addition to that, what we've also had is I think due to those pressures are due to our challenges around workforce. So workforce, particularly within the care, external care market, we continue to have providers who report and provide feedback that they are struggling to recruit care staff across the board. And that's been a feature throughout the past 6 to 12 months, really. And we're likely to see that over the next 6 months at least. Our projection is that we're not really going to see significant increase in our home care services, and so we've got some real challenges around that. In addition to that, what we also have is pressures around our internal services. We have a number of roles where we just are finding very challenging to recruit, particularly around social work posts, occupational therapist posts, and community care officers. And just more recently, my area, which is around strategic commissioning, we're also now beginning to experience challenges around recruiting staff around strategic commissioning. Now, without knowing what the future holds in terms of we can't really predict whether things will improve over the next 6 months. What we have got is we have got a number of plans in place, mitigation and recovery plans to address some of these challenges. And again, I think we are optimistic that some of those plans around workforce, around apprenticeships, working with agencies and recruitment providers will make a difference. However, this is not unique to Nottinghamshire. This is across adult social care across the country that workforce challenges are our biggest risk at the moment. What we also have had is other factors in addition to workforce, obviously with challenges with COVID, has also been incredibly complex and challenging for our staff, for our providers, and again, we've been in that constant response of crisis and emergency response. Having said all of that, I think what we are now slowly moving into more business as usual. We've got to live with COVID and find ways of how we can actually operate our services as best as we can within that context. And so over the next couple of weeks and months, what we are looking to do is look at all our performance areas to ensure that we have robust recovery plans and actually try to set out what does good look like for the next 6 to 12 months based on our capacity that we've got. So that we just wanted to talk through that context around some of the challenging circumstances that our external market and our internal services have been having to operate. In addition to our pressures around performance and capacity demand, I think it was quite really nice to have a slightly different discussion around our visits, the virtual visit from Lynn Mayo, our chief social worker, and it gave a really good opportunity for our staff, for our practitioners to talk through strength-based practice and the difference that's making. And I think that was a really good opportunity to really think about our practice and what difference we're making with our and improving outcomes. The report also talks through some positive around initial impact that we're having around our approved mental health AMP service and our changes that we've recently made. That's beginning to show some positive impact, and we're also seeing increased referrals for our maximising independent service. Again, that's also quite a positive that we're beginning to see increased referrals for that as well. So those were some of the key features. Happy to take any questions.
Thank you, Melanie and Cash, for that. I'll open up for questions. David, did you want to? No, he's saying that it's not streaming. Okay. Just 1 second. You've been informed. Have you got a question afterwards? Okay.
Did you see Jim?
I've got Jim as well, yeah.
You want me to wait?
Yeah.
It's reassuring, David, to know someone's noticed.
Sorry?
It's reassuring to know someone's noticed.
Yeah, it is, isn't it? You never know. You never know what they're up to out there, do you?
No. Well, we'll wait for the live recording to start before you get your time to shine, Councillor Martin. All good. Okay. Thank you for your patience. And okay, Councillor Martin.
Okay, thank you, Chair. This financial report really brings home the challenges faced by authorities like ours, especially recruitment and rising staff absences. Paragraph 13 states the department is also to face challenges recruiting and retaining social workers, community care officers and occupational therapists, and paragraph 16 mentions the rise in absence levels and mentions stress-related issues. Are these two intrinsically connected? I note, Mr Chairman, that last week the British Association of Social Workers released their findings from their first annual membership survey, answered by over 2,000 social workers, students, academics and retired practitioners and others across the UK. The findings told of a huge concerns with workload. 72% were unable to complete their workload within their contracted hours, and among this group, 24% were working at least 10 hours extra per week on average. Are these findings reflected in Nottinghamshire with our staff? The three biggest challenges for the profession were a failure to fund social care adequately, with 67% complaining about that. 61% respondents to the survey complained about cuts to local services, and 35% said they didn't have enough time with people who use the services. It's also said there needed to be action to tackle poor working conditions, unfeasibly high workloads, which were a major source of stress. Is this reflected in the increase of staff absences here in Nottinghamshire, as evidenced in paragraph 16? The report almost skips over the actions we're taking to reduce this. It mentions a number of actions within the workplace wellbeing plan, including doing staff surveys. Do you not agree that this needs to be addressed through more support, resources and opportunities for reflective practice, as called for by the British Association of Social Workers, and a reduction of bureaucracy in their administrative burdens, including through investment in our administrative staff? Because our staff appear to be burdened by pushing pens and not pushing care. And do you expect the results of the extra surveys to state this? The whole idea of the Smarter Working programme a few years ago was to help relieve the stress on our care workers. And I feel that we may have gone too far with some of the paperwork and the stress on some of our staff. And so now they're overly concerned with filling in forms sat outside somebody's property in a car, sooner than going round from one to the next. I think we might need to do a review on streamlining some of that paperwork, because the burden of that academic paperwork that they're filling in seems to be burdensome on the staff.
Thank you, Councillor Martin. I can see why you wanted the live stream back on there. Okay. Retention and recruitment has been an issue and is an issue, stress related. I'm going to hand over to our corporate director, Melanie, to pick up your points. Okay.
Yeah, thank you for that important question, Councillor Martin, because our staff well-being and those of the 22,000 people that work in social care in the county more generally is one of our biggest concerns. So the purpose of the report wasn't to comment on our workforce strategy, but I thought I'd just highlight some of the issues. And there were a lot of questions in your statements, so do bear with me if I've forgotten one aspect of it. So first of all, I think the point I'd like to make is that social care did not pause or stop during the pandemic. So the impact of that for staff is that whilst other people were sheltering from the risk of infection in their homes, in adult social care people continued. And not only did they continue, but many people also took on additional duties whilst they were covering for colleagues who were absent from work with COVID, or some of the pressures that people are experiencing. So, for example, in Ainsley's service area, people moved from working in day services to working in people's homes directly. So they kind of were dealt with that double pressure, really. So still working, not able to protect themselves from infection, dealing with increased PPE requirements, and then doing tasks that they weren't familiar with. So that takes some toll. So we do know that those changes are what staff are telling us is an impact into their increased absence from work. And I would say that we've seen that internally, but we certainly know that from the adult social care workforce in the community, because as everybody knows, we don't employ as a council most of those 22,000 people. We only employ a proportion of that. You mentioned about the BASWA survey and some of that impact. So we do an annual social work health check here in the county council. We don't normally report operational matters such as that to committees. We don't often bring up the findings of that. We tend to refer to that indirectly in our reports, but that's a really important piece for us, alongside what we call our pulse survey. So that's a survey that I undertake to try and get a bit of a sense of the temperature check out there in the workforce, if you like. So we do know that people have reported that they feel they spend more time in admin work than face-to-face work. So you'll have heard Sue Batty particularly talk about the the improving processes of work that's part of our transformation work that was approved by committee last year, so in 2021, and that is to try and do that. That's to try and take away some of that admin burden. But I think it's really important to note that reporting properly, the outcomes of your supervision, the outcomes of decisions, and the outcome of our work is a really important bit of social care. So our task is to make sure that we're making that as slick as possible and not adding on burden. But that kind of case recording is a really important part of what we do, actually. So I think that's quite important to note, that there will always be that element of, if you like, admin work. But to me, that's part of our intervention in the workforce. So we have got a really robust corporate wellbeing programme that's happening. As a corporate leadership team are owning that, and the adult social care bit really is running alongside that. So we're running additional supervision sessions. Our mental health first aiders are offering sessions, and we've got some focus time to talk sessions, they're called, for staff. So anybody who's experienced trauma, because it has been traumatic working in adult social care the last 2 years, is able to access that. So have I covered off most of your points, Councillor Martin?
Yeah, thank you, Mel. Yeah, I think the point is, obviously we had the Smarter Working programme back in 2016 to help our staff, and it really accelerated the output, and it enabled us to track the staff, especially when they were in tricky situations, shall we say, with certain residents across the county, and their health and well-being, their whole working life process changed during that period, and rightly, advantageously so, prior to COVID. And I think some of those staff came in to be care workers and social workers, or whatever occupational therapists or whatever they are. But they probably didn't necessarily come in with a great background of IT. And some of the academic forms that have been foisted on them over the last couple of years perhaps need a review. So they're simpler for some of those staff to use and quicker and easier. Because I've met care workers outside properties, talked to them about what they're doing, and that would be the feedback that I got, that they may be 20 minutes in the house and 40 minutes in the car. And it's great that they're doing the paperwork online. It's going straight into your mosaic, isn't it? And that's good, and it's all good. I think we're 3 or 4 years down the line, we might need a review on how to speed some of that up and ensuring that the staff are capable and happy using the IT gear, because that's probably causing some of the absence, especially during COVID, because they've had twice as much paperwork to fill in. Thank you, Chair.
Thank you. Melanie, Councillor Carlton, did you want to say? Do you want to?
Just really quickly, so the pandemic has forced us into using forms of technology that none of us are familiar with, and that some of the mechanisms, like doing Teams meetings, has been brilliant in some circumstances. So we've seen a massive increase in multidisciplinary team working, but equally it's taken a toll on our mental health, where dialogue through a screen. So we are taking that into account. So you're right that investing in Not's piece of work is still really important, and optimising technology. But we've had, because of the pandemic, we've had to implement things at speed. So that is something we are taking account of as well. Thank you.
Thank you. Councillor Carlton, did you just want to pick up something?
Yeah, it's just to pick up on a comment on that sort of in and around workforce, and it is appropriate that we look back over this last couple of years to learn from COVID, whilst we acknowledge it's been sort of a deep and hard time for many, that it also showed a different way of working. I will just remind committee that in January this committee did approve the personal assistant support service. If you recall from that committee paper, one of the points being made there was about streamlining, taking admin off our frontline social care workers and allowing them to deliver their care packages. So you make the point very well. I completely agree, and we are getting on with it.
Doing it. Thank you. Okay, Councillor Creamer.
Thank you, Chair. Just combined when they're actually mentioning the challenges and the challenges being faced by our workforce and by the carers, which is, I think we're all extremely grateful for, and the work they put in. But have we got any future planning now for the energy crisis, the possibility of losing extra care homes and losing those placements? So it's just a question about the future planning, on various issues of the staff recruitment, etc., etc. But at this moment in time, at least, especially what's happening in the world, I think the energy crisis could come and bite us fairly quickly. So I'm just wondering, do we have any emergency plans or plans for that?
And yeah, I'm going to hand over to Melanie again. we will be coming to. This will be picked up later on in the meeting as well. Not directly, but I'm sure it will be raised.
Thank you, Councillor Creamer. So later on, we're talking about how we're meeting some of those costs that are pay-related inflation. But I think you're right to reflect that some of the economic uncertainty we're facing, it will also impact on some of our providers with fewer people travelling to work. As it stands, we haven't been looking at that piece of work, but it is something well cited on in terms of the corporate leadership team. But yeah, no, you're quite right. There's a huge amount of uncertainty in the coming weeks and months about some of those costs.
Councillor Carr.
Yes, thank you, Chair. Paragraph 17 talks about mobilisation of existing council employees. Can I actually ask what this means in practice? And can you give the committee some assurances with regards to their training and their experience to be able to fulfil these roles? And also in paragraph 28 talks about the not delivering savings, which was expected and not and entirely understandable why we haven't, due to what's been happening over the last 2 years. But I'm a little bit concerned that there is a paragraph that says that the department are going to have to make considerable bigger savings in future years. Can you advise me what discussions have taken place about cuts and inevitable impacts on services moving forward?
So you
using internal staff.
Yeah, mobilisation. So
It's a third bullet point, paragraph 17.
Bottom of page 11.
Yeah,
Cash.
I can come in. I can come into that. In terms of mobilisation, what we've done is over the past year and longer is that we've had backup services where there is a provider that is actually handing back packages of care and support. We have contingency planning, and so particularly in Sue's area, we have a number of services that will step in if a care home or a nursing home or a home care provider begins to struggle and people need essential care. So therefore, we have to have the ability to mobilise staff in other roles and other services, and that's been a key feature in terms of our contingency response. So that mobilisation has been key. In terms of our staff are highly trained and they're able to work in all of those care settings, and they are supported throughout that process. And again, I think so. So that's just in terms of that context around mobilisation. We will continue to have some of those contingency in place due to the risk and fragility that we've got in the care market as well. I just also ask if Sue wants to add anything else onto that.
Okay, thank you. And the next one was about the savings. Yep. Okay, Melanie.
So because of that scenario that Cash has portrayed, the staff within Sue's area reablement haven't been able to do their reablement type work. So that's had the result of that the savings will be moved into next year. So the plan is still the same. The plan is still the same, that we will be doing that work with older adults and supporting their independence. It's just that we haven't been able to do that because staff have been redeployed into supporting day-to-day care.
Councillor Doddy.
Thank you, Chair. Just to follow up, it's a funny world that we live in terms of the fact that sometimes adversity can throw us into positions where we find ourselves doing things which we wouldn't have necessarily thought of. And a lot of people didn't go into care because they were afraid of COVID and stayed out of homes and stayed in their own homes. Indeed, were supported in their own homes, perhaps by wider family members. In terms of collateral damage, we often think about what was negative about it. In terms of collateral benefits, what things do we think in adult social care that we've learned from the ability of people to stay in their own homes as opposed to going into care? Did we use new technology? Did we have a benefit of a wider social network protecting them at home? And is there anything that we can save from this period and use in a positive light? I know about technology. We heard about the increased use of Teams, greater team meetings, greater cooperation amongst the staff. Is there any little kernel, any little jewel that's come out of people's ability to stay at home, either through the wider family, through the use of technology, that we can garnish from this going forward that will be in a positive benefit and something we can salvage?
Oh, yes. And I can see Ainsley is chomping to fill you in a bit further. Okay, Ainsley.
Yeah, so I think you're absolutely right, Councillor Doddy. I think one of the things that adversity brings out is, I need to be flexible, responsive, and innovative when you've got a crisis. There's several things that spring to mind for me. I'll give you an example from our day services. Quite quickly, we had to close down our buildings, but we didn't close down our service because people continue to need care and support. And for those people who were at home with families, we, as Melanie said, there was a lot of people that we actually went out to the family home. But for people where they perhaps weren't comfortable with that, what we didn't want to lose was that contact. So our services had things like, they were running online cookery sessions with people where people were doing it in their own kitchens with family members, but being led by our support staff. They were running quiz nights, they were having friendship groups come together online, and that was really great. And actually, is something that for a lot of the services, they've continued on with that type of thing because it did work really well. Equally, I think the thing that was one of the big successes that we saw right across the county was how local communities mobilised themselves to support vulnerable people. And throughout the pandemic, I've been a member of the Humanitarian Assistance Group, and there's been a real focus on, that sort of community asset building, working with the district councils, working with other community groups who mobilised incredibly well, whether that was delivering medication to people, meals, social contact, whole range of things. And there's been a real focus on trying to retain, not in full, because a lot of people who were perhaps furloughed or working from home were more able to give support in their communities, and a lot of people have returned to work now, but there's a real will to hang on to that and resource that in some way, so that we don't lose the will of those local community groups. So I think they're just two examples. There's many more, but I think absolutely there are some positives that have come out of the pandemic that we are hanging on to in future.
100% echo that, and keeping that community, well, it woke the communities up as well, and got all those community groups active again. We're still doing it in the villages where I am. In fact, I'll go shopping after this. I have the list here for the old people. So yeah, I got to meet people that I'd never met before, and then interact with other groups. Other groups have started. I've got Paul Henshaw.
Thanks, Chair, for bringing me in. I've said it before, the social care staff that we employ, social care staff in the wider community have gone that extra mile during this pandemic and have supported people in many different ways. And those ways can be seen to be challenging in many respects, not only for the providers, but for the people that are receiving the care. It's interesting to note in the report the two items on the underspend in paragraph 7 and paragraph 9, and the things that we're going to do hopefully to mitigate those underspends in the coming months and in the next financial year, and we'll be watching how that's rectified with great interest. Nevertheless, when we look at, as Cash mentioned, external care packages, do we think that the remuneration we give to external providers is sufficient for them to meet their requirements in relation to the services that they provide? I mean, I suppose there's always a debate whether or not we are paying enough or not paying enough, but I think it's something that we should really take consideration to. Our internal staff have, as I've said, gone over and above the call of duty, and in relation to some of the new ways of working, Councillor Martin mentioned the paperwork and the things that care staff have to do online in relation to recording information, and I think it's very good. But if there is a problem with that, we need to look at it. We need to make sure that the information that we are collecting, that we are using, is valid and is not going to be lost in appropriation somewhere. And also, I think our care staff may need additional training in relation to that sort of new technology. It's very important that if you ask care staff to, for instance, go on a computer program about what they are actually writing down about people, we need to make sure that they are fully trained and are aware of how to use that technology. It says in the report that what in the recommendations, what does the committee think considers whether there are any further actions it requires? Well, I think one of the things that this committee can do is to use our officers and use the leader of the council and lobby the government in relation to the social care crisis, because the local government association in their deliberations, the 36 billion social care levy that's going to be raised over the next 3 years, only about 5.4 billion of that is actually ring fenced for social care. And I think that we need to be asking the government to free some more money up in relation to that, because there is still a crisis in social care. And I think what we're tending to do, we're trying to make the best of a bad job, and it's very difficult at times, and that puts more pressures on us in relation to providing services. It puts more pressure on the people that we commission to provide services, and it also puts more pressure onto our staff that, as I've said, have done a fundamental job. So I'd like to see, as part of our further action, to lobby government in relation to the social care funding that is available. Thanks, Chair.
Thank you, Councillor. What I'll try and do is dig out the footage of the leader of the council doing an adjournment speech the week before last. Did you? So you know that he is lobbying. Yep. Before I hand over to Melanie to pick up on the remuneration part, Councillor Carsey, do you want to come back on?
I just wanted to support what Ainsley said about some good has come out of the.
Yep.
I mean, for example, I know, including my street, we all set up WhatsApp groups, made sure the older ones who weren't technology savvy could do it and were set up on it, and that's carried on. And I know with many examples in my division where that happens, and what we need to do, the challenge is actually keep it going.
Keeping the energy there.
Yeah.
Yep. Okay. Yeah. Thanks for that. Melanie's going to pick up on your remuneration part. Then I've got two more speakers. I've got Councillor Pringle and Barney after that, and then we'll go to the vote. I think we've.
Yep, so the fair price for care will be tackled in adult social care reform. So in the spending review, there was a fund announced of which Nottinghamshire has a share, and that's to undertake a fair cost of care exercise regulated activity. So the requirement is that we undertake that through the first part of 2022, so that's a financial year, so Q1, and that work is done in collaboration with providers, and that will inform a market sustainability plan for September 2022 that we have to submit to the Department of Health. So I'm expecting Councillor Henshaw that will tackle that very issue about affordability and sustainability.
Councillor Pringle.
Thank you, Chairman. Firstly, just a word to Cash, really. You're aware of this, that irrespective of what party leads the council or what party leads government generally, the prioritisation of care will be representation of that. So there'll always be scrutiny from one party to another in what we lay down. That doesn't necessarily mean that we disagree with what you're doing. So I think there's a lot of positives in this report. Paragraph 16 was a bit of a concern to me, and Melanie's actually responded to that in the routes that certainly our staff are able to report, which is a breath of fresh air, because I think that needs to be something that is easy for our staff to be able to do. And again, when we talk about 22,000 employees in the industry itself, you know, there's going to be those that are top of the tree and there's going to be those that are going to need support. Those that need support are still probably as passionate as those at the top of the tree. So there has to be an ongoing training program that allows us to provide where we can. And I think it would be easy for me, and I say this wholeheartedly, to say I would like to see have another couple 100 million to be able to change what's happening in Nottingham at the whisper of a wand. And we know that is absolutely not practical for many reasons. In fact, you point out many in the demand for staff and what you're doing. Marlon has allayed that with the changes that are being made from the savings this year moving into next year to try and counteract that. But I don't get that, you know, it's a national thing. It might be. I'm not bothered nationally. I want Nottinghamshire to be at the top of the tree. So anything that we do, I want us to be at the top of the tree and to be prominent for everybody else to follow as to what we can do. So if there's things that are brought up here that are good, then we should take it on, or we should debate it further and move forward with it. My concern, really, for Melanie is the financial implications, as Councillor Carr mentioned, paragraph 28, and where the other savings are going to be expected at a time when, you know, I know from 5 years you're cut to the bone to where you're going, and my concern is I would like to see the roads painted gold at everybody's house that we're going to go and get, and I know that's not going to be the case. So I'm really concerned about these other savings that are going to be made, and I'm sure you'll be able to do it. But the recommendation that follows is simply for Cash just to return with the positives of anything that we're moving forward, because I think it's vital for out there on the street to see the positives. We can argue over the negatives constantly and how we prioritise them. But I think there has to be positives, and if our staff are cared for and our finances are working out, that we're providing the best service that we can and we have room for development, then I'll be happy. Thank you, Chairman.
Thank you, Mike, and I think you're right. I wholeheartedly agree that the outcomes, and we all want the best for our residents, and it's how we may have differences on how we take that journey, but it's the outcomes that can. Okay, one last speaker, Councillor Barney.
Yeah, thank you. Councillor Pringle actually set up beautifully what I wanted to say, which was just to reflect on some of the positives which haven't yet been brought out in this document, just because I feel it's important to do so for the benefit. We've referenced several times the 22,000 staff who every day are doing extraordinary things. We know we've been through the most difficult and challenging times, certainly in my lifetime, and for many of us that we're still in them with COVID and with all of that's going on now in the world and the anxieties that's bringing. We are so acutely aware of the pressures and the difficulties. But for that reason, I just wanted to touch very quickly on a couple of the points. So promoting independence workers, it's great to see that obviously those services were suppressed because of COVID, but now we're coming through and seeing the real benefits of that support and the support we're able to give to those working towards their personal independence goals. I think that's absolutely fantastic. Also, just in talking to officers, again, we've mentioned the visit from Lynn Romeo. I know that from talking to officers just how positive that was and what a fantastic day that proved to be. But the report, there's a couple of lovely stories that are in the report for the benefit of people on the live stream that might not appreciate this. I don't know, you read these reports, they go on and on, they're as dry as dust from time to time, but you get to the human stories. And there's two lovely human stories in this report, just two. And again, reflect on the 22,000 staff. There's 22,000 stories every day, probably, which are extraordinary. We never get to hear. But there's two in this report, which I just wanted to mention. One about Lisa, who was working with a family with vulnerable adults, who got involved, providing all sorts of supports, but discovered they didn't have a washing machine, and funding was made available for washing machine, which then led to relational aspects and improvements as well in the people's care. Fantastic. Another lovely story about Jessica and equipment she received. Just absolutely fantastic. So I just want to applaud our staff in that. But just final question I had about the mental health services. So paragraph 21-22, again, we're seeing the benefits of the approved mental health practitioner service, and there's some data provided about what that actually means in improvements for people with the most acute mental health issues, and how often they come into the care and into the service, depending on what situations they find themselves in. It details here a 5% improvement in the timeliness of assessments, reducing the time spent in suites and custody and A&E overnight. It details the decrease in assessments through more effective triage. And finally, it mentions the 15% increase in the use of formal admission as a less restrictive option to compulsory detention. I just wondered if you could detail, is that a direct result of the service that we've brought into play, or is there other reasons? I mean, it's something to celebrate. Thank you very much.
Yeah, no, that is a direct result of the changes that we made to the AMP service. If you recall, we moved from a sort of traditional Monday to Friday 9 to 5 type service to now having a 24/7 single AMP response, and so these figures, although it's still been a short period of time that 24/7 service has been in place, but we have tracked and monitored since its inception, and I'm really pleased that we are seeing the benefits that we'd hoped to see from the change.
Thank you. Okay, thank everyone for their contribution. It's so easy to pick out the negatives, but I think we should highlight, and it's so important to highlight the positives, because it's been a difficult time for everyone. Okay, so we'll now move to the vote. I'll ask all those in favour, show of hands. That's unanimous. Thank you. Agenda item 5 is changing to staffing establishment to support COVID recovery, social care reforms and greater integration with health. This report seeks to make some changes to the adult social care staffing establishment. The new and extended posts across a range of teams and services will support the delivery of a number of the department's key strategic priorities, including supporting continued recovery from COVID-19. The planning and implementation of statutory adult social care reforms and continued work to support greater integration between health and social care. I move the recommendations as set out on page 5 and 6 of the report.
I'll second those, Chairman, and reserve the right to speak.
Thank you, Councillor Carlton. Hand over to Cash to present any further.
Thank you, Chair. In terms of this report, it's very much around the changes around our staffing establishment is to support our 3 distinct areas of work, and those 3 distinct areas of work around recovery, social care reform and health integration. And so just I'll talk through some of the key roles and its purpose. So in terms of social care reform, we know that there's a significant emerging reform agenda for adult social care, and in order to respond to that, we are seeking extension around the group manager post for 12 months to support in that capacity to deliver that work, and in particular to support the work around the market sustainability work as well, which is a key feature of social care reform. In addition to this, we will need, in the report also highlights the need for temporary finance assistance. There's quite significant work around reform around charging and around finance, and again that will be a key element that we will need to ensure that we are working on that aspect. In terms of the other areas that I'll just briefly also talk through is recovery. We are continue to work on our strength-based practice, tech-enabled care. So again, earlier on we talked about digital and innovation, and again that's been a key feature throughout the pandemic, and we want to mainstream that, make that as a business as usual. Peer-to-peer support work across the operational teams. So the team manager post, again, in order to continue that work, we're seeking permission to extend that post for 12 months. And all of these posts are within existing budgets, and it's about how we can be creative and use our finite resource in a different way to support our priority areas. And then I'm also want to just also briefly touch upon health integration, which is a key feature, not just within our social care reform agenda, but also recently the health white paper was also published, and again that was a signal around how local systems will work towards health integration, and I'm incredibly excited that the post for a joint head of quality market management post with health will actually help us with that journey and make progress. In terms of why around quality market management functions exist both in adult social care, but also their responsibilities are also for the same for health, and there's a real opportunity. How can we work collectively in a more joined up way by having a joint post that will bring those two teams together, bring those two functions together, and actually those two teams of functions have worked incredibly hard in a very joined up way throughout the pandemic, and what we want to do is build on that and ensure that we have got a really joined up approach how we develop and shape the care market, and ensure that our care market is sustainable and is able to meet future needs. So those are some of the highlights from the report, and again very much help us on all of those distinct agendas.
Thank you, Cash. We've got Councillor Doddy.
Thank you, Chair. I'm delighted to see Cash's excitement about the joint post. The integrated care service has been evolving slowly in the background, and is slightly delayed till probably July 2022. And lots of people have heard about integrated care, but perhaps it's hard to have a vision of what it will look like as we move forward. Where is the integration? And I think up till now, it's always been parallel lines where the hospitals exist and discharge people into nursing care and care homes, where the council put people into care homes, where care from the NHS transfers to care to social care to pick up the tab, and the actual individuals in care don't really care. They want a continuum, they want a seamless line, they want integrated care, and this is the type of post. If you want to know what somebody does, walk in my shoes, and that's why you have to have people who work across services. The NHS has to understand what social care does, and social care needs to understand what the NHS does. And we did this first quite a while ago when we took a planning officer from, I think it was Brookstow Borough Council, and brought him into the department to understand the pressures under housing, etc. And this is the type of thing that will shape, model and draw a picture for us of what integrated care actually looks like. It's about people planning together for that same person over the continuum of care. And I have to say, I share your excitement, Cash. It's really positive.
Thank you, Councillor Doddy.
Thank you. Yep. Councillor Martin.
Yeah, thank you, Chair. Yeah, I mean, first of all, I'd like to start by saying I commend the staff for finitely tailoring the new staff and the permanent staff that you're making, and also I'm impressed that actually we're retaining staff at this level to move on for another temporary period, because we've got to face it that COVID's not gone away, and we still, I mean, we had 131 admissions last week, and still 11 and 13 deaths in the last fortnight. So we think COVID's gone away, but these staff are key in the front line and still continuing that, and people get complacent. And I think I'm really impressed by the public health officer and Mel for actually having the foresight to tailor it and to continue with it. And of course, Councillor Dodd is quite right. Joint head of quality and market management is very important for continuation of care of our elderly people, especially when they're moving from hospital into care homes. So I think it's a really good report.
Thank you. Councillor Pringle.
Thank you, Chairman. A list of employment and continued employment is obviously something which we should applaud at this time. I'm concerned as to the impact of a 12-month contract. I think that sometimes can be unjust to those people that moved into position and to the policy that's been progressed. But I think it reads as if it's a bit of joined up, sensible work in here. And again, Cash, you said previously that this will be a robust recovery previously, and I'm sure this is going to be part of it. And I'm sure members will raise questions if anything shouldn't be robust. Thank you.
Exactly that. Thank you. Got one more. Councillor Kerry.
Yes, thank you, Chairman. This is really important. This is a really long-term strategic issue we're dealing with here, that the social care health integration. And I think it's very difficult for people to understand what the real outcomes are to individuals as part of this long-term process. It's not just about people coming out of hospital and put into social care. It's a much wider about their long-term health outcomes in our community of all levels, of all ages. So I think it's really, really important that the work that this will bring is that strategic integration, development of understanding what people's needs are and delivering them in those different contexts. So I do fully support this paper. Thank you.
Thank you. Councillor Henshaw.
Yeah, I too. I mean, obviously, social care and health integration's coming and it's down the line. So these posts and these plans are going to prepare us for the future. What happens? So in relation to the report, I think our group will obviously be supporting this. Obviously, down the road, when all these care reforms and integrated care boards and things actually start working, it could only be a good thing for making sure that people that are in hospital or coming out of hospital get an integrated care service that meets their personal needs. And I think that's the important issue. Any reform can adjust figures and move management positions about. It's all down to the service that the people on the ground who are coming out of hospital or not going in hospital are getting, and making sure the service that they get is integrated to their specific individual needs. So we'll see how things develop in the next few years, but we support this. Thanks, Chair.
Thank you, Paul. I think it's great to have everyone support. I think we can all see the benefits of these posts, and there are reasons why the contracts are those lengths, and they are explained in the bundle there. Okay, so we'll now move to the vote on the recommendations as set out in the report. All those in favour? That's unanimous. Thank you. We'll now move to agenda item 6, which is the Nottingham and Nottinghamshire Carers Strategy. The report sets out the vision for supporting carers of all ages in the future across the whole of Nottinghamshire, including Nottingham City. A draft carer strategy has been co-produced by carers with lived experience in partnership with partners of Nottingham and Nottinghamshire Integrated Care System to ensure all local carers can access the support they need regardless of where they live. The key benefits of this integrated approach in supporting carers will be to strengthen and enhance the way carers are identified and supported by making the best use of joint resources. The report recommends that committee approves a public consultation on the draft strategy. I move the recommendations on page 7 of the report.
And I second those, Chair.
Thank you. And I hand over to Sue.
Thank you, Chair.
Great.
So I'm really pleased to be presenting this strategy to yourselves today, and I just want to make a couple of points about it to bring it to your attention. So it's a 5-year strategy, and the aim is that it will really take us forward to delivering the national adult social care reforms around people at the heart of care, the white paper, and also the council plan objectives, because clearly it's got at its front all about helping people live healthier, more independent lives and supporting communities and families. So we've already been discussing today, we know that informal carers have been significantly impacted by COVID. We've seen a lot more people taking on a caring role, and we've seen many carers experiencing higher stress and fatigue levels. So supporting these carers and also our future new carers is a priority within the strategy and also within all our recovery plans. During COVID, we also learned a lot about different ways to support carers, and embedding this in the future is a key part of the strategy. You'll see it's wrapped around one of the diagrams. Although it was difficult in many ways, the Carers Hub did set up a lot of online groups and online forums, and that really worked very well for some carers, not for all, but for some carers who maybe found it hard to leave the house or leave the person that they looked after. That works. So it's very much about having that mixture available for people. And carers also will help set up their own groups and self-run those as well and keep in touch. So the strategy is a really good example as well of the difference that co-producing our work with people with lived experience can bring. And I think it's really clear, you can see that throughout the strategy, including how it looks and feels. And another key point that I just wanted to bring to your attention, that it is really important that we're doing this strategy across city and county with a variety of partners, because that will give us a more consistent integrated offer and reduce any unnecessary variation that people might experience depending on where they live. And carers have fed back to us that is one of their frustrations. For example, if they move across boundaries, their offer may well change, etc. So I'll leave it there. I'm happy to take any questions.
Thank you, Sue. And I commend it. It's a great read there. And I don't, if people that sat on this committee for a while, last time we had a film showing us the strategy, and it was also not just played at the committee, but also played on our lunch at full council. So if maybe we can get something similar to that. I've got Councillor Carr indicated to speak.
Yes, thank you, Chair. Just to point out, I know it's good to point out good things, but I think you'll agree with me, it's the role of opposition parties to point out things that are of concern in order to make them good things, which is why very often ourselves and the Labour group will bring out things that we're concerned about. It's not to try and be overtly negative, it's scrutiny and what can we do better. There are some figures in this report that are extremely concerning to me. The fact that the estimate is that we've now just got over 189,000 carers in the county, and does that include the city as well? Just the county, right. But even more worrying, and I'll repeat this twice to let it sink in. We've got 5,562 carers under the age of 25, and of those 650 carers who are between the ages of 5 and 17. Now, I joined the party I'm in a long time ago because I'm always of the opinion that people should have opportunities throughout their life, from the moment they're born to the moment that they leave this earth. What opportunities are those 650 children missing out on? What is the effect on their education? I mean, to me, and if you look in paragraph 23, the proportion of carers who are reported that they've had as much social contact as they would like, actually the figure there we should be highlighting is that 76% of them don't think they're getting as much social contact as they're getting. And I bet you if you ask the 650 children between 5 and 17 whether they think that figure would be a lot higher. Now, I think this is really, really crucial. Are these children going to go to college? Are these children going to go on to university? What are their job prospects moving forward? Will they have job prospects or do they have to care full time? To me, I would like to know what the strategy is going to do for those children. Thank you.
Yeah, I think you bring out some good points, and I agree that those are areas that we are focusing on. We have identified and worked with more carers every year, older carers and young carers as well, and we're working closely with children's on younger carers. So obviously the work that we do with those young carers is absolutely to make sure that they've got the same chance, that they are able to do that caring role without it negatively impacting on their health and well-being, and to put in the support that they need to be able to avoid that. And some carers, some young carers are very proud of the role that they have, so that's absolutely our strategy with young carers, and we are reviewing the support offer that we've got with young carers as well, because it's just to make sure that continues to meet their needs. And we both with all age carers and younger carers, a key part of this strategy is how we identify more and more carers, and that's why we're working with our GPs, etc., much more closely. We are able to do that. So we have got some variation in GP practice in terms of how many identify. So we're targeting work with our colleagues in primary care where that's lower, because it's about how we work with different partners to identify people, and as you know, schools and children's services with the young carers as well. And also I think one of the things that I'm very keen and always looking at is the issue of people that we support, and also carers who often don't feel that they have as much social contact as they would like. So that's going to be a key piece of this work going forward on how we improve that. And I do think that the digital offer does help some of that. We have seen, we did a bit of a survey over COVID, and again for some carers that social isolation was reduced just through some online contact, and for some people that works, so we're not going to stop any of those, we're going to keep those going. And we're also actually have a new strength-based approach to our work with carers, so it's less focusing on a process and the form and more about having conversations, starting with questions about what would best make your day better here and now, so that we're really focusing straight in on what will help carers.
Thank you, Sue. Thank you, Steve, for a very poignant question. I've got Councillor Pringle.
Yeah, just to follow on from Councillor Carr, really, because I think the graph and those figures for the 5 to 17-year-olds is shocking, really. Although I do, something I didn't take into account was the fact that the assumption that some of these carers really do want to be the carers. That's something I probably didn't realise before that, and assuming that if that's the case, then they get the full support that they can. But we're now just touching nearly 200,000 carers. And sorry, I know Steve said, is that including the city, or is that just the county? Just the county. Okay, so that in itself is a number I wasn't expecting to be at this rate, because I'm not sure that the county itself will have increased its residents by a similar amount. So is there a reasoning behind that? I've got one more for you, Sue, which you'll find, sorry, and I'm sorry, that's right. We're talking about the financial implications, and I get the Better Care Fund budget, but in 29 it says should be covered, and in 31 funded in the main. If it's not coming from the Better Care Fund, where is the other coming from that we've not actually that we can't take out of that? Thank you, Chair.
Yes, thank you. A couple of good questions there. So it is a very high amount of carers, and you know that's based on the data that we have. So I think it's just important to remember that the council isn't the only agency supporting carers, which is why we're really pleased that this strategy spans not just health and social care, but other agencies as well. Supporting carers is something that we can all do because carers need different things. And not every carer needs support. Some carers are able to manage without. So the number of carers has increased steadily year on year, and our resources linked to carers has increased year on year, including the services that are outlined in this strategy and report, which are carer-specific services. And just to come back to where the costs, so all the services that are things like respite services and short breaks, they come from our community care budget because they're linked to the assessed needs of the person that's cared for. But we spend about 5.5 million just on respite and short breaks for carers, as well as having a range of other things like day services and daytime activities as well.
Thank you. See, council's also, these numbers, they appear alarming, but the council's done an awful lot of work to identify these carers. So a lot of these were around prior to that. And if you look at in the yellow papers, 57 of 104 are plans going into the future. Sue's already mentioned the breaks, replacement, development services to support the whole family. So we are working, we're getting them there. Okay, I've got Councillor Henshaw.
I think society in general owes a debt of gratitude to people that are unpaid carers for the unsung work that they do day in, day out, week in, week out, year on year. I mean, it's a commitment that, and quite rightly been highlighted, that some younger people are participating in, but as it says in the report, the care provided by these unpaid carers ranges from young people to possibly an elderly couple that have been together for 50 odd years, and then they find themselves in a position where they've got to support each other, and they do it gladly. And it's right that we undertake this consultation so that we can get the information that we need, because I mean the point that springs to mind in paragraph 8 where there is a gap between the number of carers that will be in Nottinghamshire from the data and those in the council knows and supports. I mean, it's vital that we work with other partners and other health professionals to gather that information and utilise it to the best of our ability. So my only concern is that the budget allocation of 1.5 million per annum is enough for the job that it needs to do. But I mean, obviously, if we have a consultation and things are highlighted, we could possibly press it budget time to increase that. But overall, yeah, let's get on with the consultation and provide an additional support for these people that are doing a fantastic job. Thanks, Chair, and we support it.
Thank you, Paul. Councillor Kerry.
Yes, thank you, Chairman. Just, I think the most important thing, this is I think the ambition in this strategy from going forward, and starting off with identification, moving through the family approach and some of the actions, including the actions on page 56, item 9 about the we statement. So we've asked people what they need. They've said, I need this, I need that, understanding from themselves and their families. We've got a we statement where we're going to, our ambition is to improve it for them, and actually indirectly the help to the carers will also indirectly improve the lives of the people who they are caring for. So it's really, really important, and it is a vision going forward. I'm sure that things we'll find out that might need to change, and that's the whole point. But we've got a strategy, and it includes the wider service provision, and I think it's really excellent and support it. Thank you.
Thank you. Councillor Martin.
Yeah, I think it's a very timely strategy because the 20 Carers UK State of Caring Survey in 21 revealed that 1 in 5 carers said they might not be able to afford to carry on. And they are a very unheard, important sector of our community from all walks of life. And particularly want to talk about one that Councillor Henshaw raised, where couples have lived together for a long while and the partner becomes the carer. And I've had about 3 cases there where the person who is the carer has passed away, and the level of care required for the cohabiter is not understood, and then they have to go off into a facility to be assessed, like the place at Mansfield, or Poppy Fields, isn't it? Yeah. And that can cause quite undue stress. So I think one of the things that we do need to do is look at those more elderly people who are being cared for by partners, and assess the level of needs before we get to that point where their partner or their carer passes away, because that's quite an important problem. Are we confident now? I mean, I have been, from my perspective, but are we confident now that we've got the release packages from hospitals correct, and that the evaluations through the start packages are correct, and that the ongoing care provided by that afterwards is the right level? Are we confident that we're getting that? And are we confident that the companies that provide that care are paying their staff correctly and doing the job right?
So you want to pick that up?
Yeah, I'll kick off. So in terms of, because of the pressures that Cash talked about earlier in the home care market, in terms of are we getting the appropriate packages, we know at the moment that there isn't enough home care, so we aren't getting people home with our short-term reablement and rapid response home care services. So more people are currently, unfortunately, having to go into hospital for a few days while they wait for that package to be available. But I think we've got the system in place that when the market issues start to free up, that we'll have a lot better process in place with our partners. And yes, confident that people are getting the opportunity to have reablement and to have that rehab at home wherever possible, rather than go into an accommodation-based facility. But for some people, I think we do need to do a lot more work, which I'm hoping to do over the next couple of years, in terms of prevention and early intervention. And I think, again, that is it's all partners, because it might be that what that couple need is better housing, for example. So, and then they might not come through to us until they're in crisis and it's been a hospital admission or the person's unable to care. So I think it's wider than just social care. It's wider than the county council. That early intervention and how we support people to plan and age well is really something for all partners in Nottinghamshire.
Thank you. Councillor Barney.
Thank you, Chairman. So Councillor Carr began this session by talking about the role of the opposition to scrutinise, and rightly so. But I love it when we can work together, and I think that this strategy here is absolutely beautifully bringing together multi-agencies, multi-disciplines, and politics as well, in a place and in a document. Unlike my comment earlier about dry reports, this is not a dry report. This is a beautifully put together report that at its heart has a heartbeat, and you can feel a living heartbeat in this report of care, of us working together across Nottinghamshire with the NHS integrated care system, the City Council and the County Council. And I think it's beautiful. I think it reads beautifully, and I have absolute credit to all of those involved across all the entities that have put it together. Like Councillor Carr and other members who've referenced the shocking details, actually, in the number of people that this report identifies who are providing daily care and support services to those around. I was surprised and slightly shocked to my own naivety. Of course, I'm aware that people are caring in the homes and doing remarkable jobs every day, but the numbers are amplified in this report and inescapable. But it did make me wonder how we actually do quantify exactly what a carer is. I imagine it's fairly broad brush. So there's a statistic in here about nationally 1 in 5 young people under 18 are caring for somebody, 1 in 5. There's another statistic that says 1 in 4, 26% of adults are providing unpaid care across the country. How do we determine and define what a carer actually is? And I've got a couple of other questions as well after that.
So you're not on mic, can we use Cash's mic?
Well, Matt's got to turn his off. It'll work now, see.
Okay, got it. So we've moved away. We used to have thresholds under previous legislation of how many hours, etc. We've moved away from that. So it's really if the person self-defines themselves as having a caring role, and that then we'll talk to them, we'll have a conversation, and if we find that support will be appropriate, then we'll help them with that, or we might signpost them. Often it's might be benefits, it might be housing, there's a raft of other things, or it might just be a one-off payment to get a washing machine, for example, that will make their life easier. So but then there's some people that are caring for people with very complex needs, and we can offer personal budgets for some ongoing help to those people.
So you've got some more questions?
A couple more if I'm allowed.
Okay.
So just in conclusion, I thought that the top 5 themes also were really powerful and really good. I was interested in point 3 in the top 5 themes talks about access to short breaks and replacement care for those who are caring to have breaks. I wondered if you had any detail on what we were able to provide with that. And also just in the we statements, again, I thought they were really good, the I and the we statements. I'd love you to have time to go through the detail of what each of those we's actually means. I know you don't, but I hope that there is detail behind each of those and they're not just vague aspirations. But brilliant report, and thank you very much.
Yes, so the detail, the we and the I statements will link. There'll be specific actions in the action plan against each of those, and those were designed by carers, so very positive. And then in terms of short breaks, so we learnt a lot, really, didn't we, during COVID? We realised that people couldn't necessarily go to a residential unit for their breaks. And we found, as Ainsley's already mentioned, different ways of giving people a break. I think there is a national and local conversation that will be part of our local work on what really do carers want as an alternative to maybe a residential break, and seeing what other areas have done with more flexible types of service. Because people... it's difficult for carers sometimes if they've had something for a long time. It's very worrying for them to shift to something new. So we need to work with carers and share some of the different opportunities that there are. And Ainsley's actually doing a review of our short break strategy and our day opportunity strategy. The aim really is to, wherever we can, that person that's cared for, to make it an experience that gives them something else as well. It's not just a replacement care going to a care home. So can we provide that respite and then get people more linked into their local community? Can we get it as an opportunity for them to try new things, etc., that might help expand their life as well?
Thank you. I've got Councillor Carlton. That's my last speaker question, and then we'll move to the vote. Okay.
Thank you, Chairman, and it's just really to follow on from a lot of the comments that have been made from all sides of this chamber this morning. It's a very sobering and real document, and I really welcome the strategy, in particular the work that Dan Godley and everyone has put into this. I also welcome the scrutiny that's taken this morning. With myself being a new member to this authority, landed in the role that I am in, I'm sure colleagues on this side will identify meetings away from this chamber. This has been a point that I've picked up on. Sort of when that young carers, as I've identified already, between the age of 5 and 17, I couldn't even imagine what it would be like to care for someone. My thoughts at that age was about playing football and getting muddy. And going to school and that sort of thing. But also when you look in the context of this last 2 years, you could possibly surmise that some of these roles are isolating roles, but then you drop that pandemic lockdown periods where it becomes even more potentially withdrawn. Obviously the strategy does give us that opportunity to really assess the need where it is needed. It's that opportunity for us to listen, work in that sort of co-production model, which will obviously be again picked up in the next agenda item. But I'm sure this is going to be supported from all sides of this chamber, and let's get on with the vote.
Just before we go to the vote, Mike, do you just want to say?
Yeah, thanks, Chairman.
Just
to say that on the report, recognising the rise in carers, are we aware if that's relevant to industry? I mean, obviously, I'm talking about the coal industry and the demand now, because we are in the latter years of generations of coal miners who will no longer be with us, probably within the next 20 years or so. So is that an impact on the amount of carers that we have now because they're caring for people that have worked in every industry previously?
I see what you're saying, yeah. But we could possibly get that to you outside. Yeah, we can look at that. Because there is Sizway, isn't it? Coal face energy. Yeah, so we could ask them for some data. Okay. So debated well. Been a good one. We'll move to the vote now. All those in favour of the recommendations? Unanimous. Thank you. Okay, we'll now move to agenda item 7. The Better Together, working towards co-production across adult social care. The committee has previously confirmed its ongoing commitment to the development of a model to support greater co-production in all areas of business. This report sets out how the department intends to increase co-production with people and carers with lived experience and the positive impact of implementing the proposed plan, including the importance of placing people and their carers at the heart of everything the department does to improve their experience of adult social care. Valuable and productive work on co-production has continued to take place within adult social care and health throughout the COVID response. The principal focus of the work during this time has been developing the Better Together plan and translating the high-level aspirations into practical deliverables. The co-production steering group, Our Voice, is a group of people and carers with lived experience of using adult social care services. Our Voice met for the first time in September 2020 and has continued to meet regularly. It has been closely involved in the scoping, co-design and development of the Better Together plan. Members of the group Our Voice are joining today to help to present the report with Cash. I move the recommendations as set out on page 4 of the report.
I'll second those, Chairman, reserve the right to speak.
Thank you. And also welcome. We've got Sarah. Yeah, they're on here now. So we've got Ed Lowe there. Do you want to introduce yourselves? Say good morning. Ed.
Good morning, everybody.
We've got Alison and Sarah's there. Alison.
Hello. Yes. Alison Fisk.
Yep. And then who else have we got? It's dark here. Yeah, Marion. Just take it in turns to. Marion? No? Okay.
You're on mute, Marion.
Take yourself off mute and just introduce yourself, Marion.
Sorry, technology is not my thing.
Okay. Good morning anyway, and welcome. Michelle?
Hello, can you see the slides?
Yeah, we can. Okay. Cash, do you want to?
Okay, really pleased to be presenting the co-production strategy Better Together plan. Despite the challenges that we've talked about around COVID and operational challenges around capacity demand, one of the key areas around co-production is we have continued to work and progress our thinking, our approach around co-production, and that's been only possible due to the energy and the commitment from our Voice and co-production steering group. We have today 3 members of our Voice group that will present some of the key aspects of the strategy. So I'm going to hand over to Ed first.
My name's Ed Lowe, Voice Co-Production Steering Group, and I'm also an expert by experience because I receive adult health and social care. Why co-production is important to me? It's important to me to work with, because it gives me the opportunity to work with lots of different people to find shared solutions. I get to use my experience to help shape services, to help shape adult social care within Nottinghamshire, working together. Being involved at the start of a project and seeing it through to the end is a massive sense of achievement. I hand over to my colleague, Alison Fisk.
Hello, my name's Alison Fisk, and I'm a carer and advocate for my son who has a severe learning disability. And I've been involved with Our Voice now for about 18 months, being an equal partner in co-producing the Better Together plan. For co-production to happen, there has to be trust, which has to be grown by being honest with each other. And this is the way we have worked together. It requires the building of relationships where those with lived experience are valued as equal partners in any piece of work. We are recognised as having skills and knowledge, and that together with professional staff, we can work to make services better. This is not necessarily a smooth and easy journey and can be fairly messy. Bringing together different viewpoints is sometimes hard, but we have learnt to trust each other and it works. This has been an empowering process where I feel valued and respected, and I'm looking forward to the future of co-production in Nottinghamshire. And now I want to hand over to Marion.
I'm Marion Wardle. I've been a carer for my husband who has multiple sclerosis for the last 17 years, although he's had the MS for 40 years. So I'm one of the elderly that is coming up to a golden wedding soon, and I'm still looking after my partner. Can I just make one aside and say how impressed I've been at the debate this morning? It's really refreshing to see politics in action. You tend to dismiss it as being separate to our lives, and I've really enjoyed the discussions this morning. Being a carer is really hard work, and I have great respect for other people who are in my situation, but also for the people who provide me with support. I have 2 hours a day support, the other 22 hours are down to me. So I feel that I really am an expert by experience, and I often call myself an expert by endurance. Being part of Our Voice and working on the Better Together strategy has been heartening, encouraging and empowering. At last, we do have a voice that we work as equal partners with people at the very top of the authority organisation. And it's been extremely rewarding because we've been able to develop relationships, be listened to and talk with, rather than to have things done to us. It's been a really refreshing, energizing part of my life. I'm so glad that it's one of the offshoots of the pandemic that we've had time to meet in this way, because I can tell you there's been a lot of meetings. So the outcomes that we are achieving already are that they are better outcomes for those that use adult care and social services. I've been part of the Making It Happen work and know very well the examples that have been quoted in the carer strategy, because that's been a co-designed initiative. And the other areas that we've worked in, we've been co-designing and co-producing with those that design the policies. They've had our input and our scrutiny, and we've been there when the work has started to be produced at all levels. We've been working with teams that are used to deliver that care. We've been part of training and it's all been to the same end, that we achieve better care for those in Nottingham, Nottinghamshire. And so the common good, I'm sorry, there's an echo on my iPad, it's really disconcerting. But the aim that we have is central to everything we do, and it's shared by those that are responsible for delivering it and those of us who receive it. And so in handing over to Cash, I just want to thank you for the opportunity to present this document together, because we are better together and it's proven. Thank you very much.
Thank you, Marion. I'm just going to very briefly talk through this slide, which is actually, in essence, these are key cogs, and these have been co-designed and shaped by our voice group, and these are the cogs that will actually drive and deliver the strategy. So we have listening spaces. It's a concept that we've already up and running, where we have a forum to listen to carers, listen to people with lived experience around their experiences, and use that listening event to make improvements and also learn as well when things go wrong as well. So it's a really good forum to ensure that we have the ongoing engagement with people with lived experience. We also have projects, and this is where, when we develop any policy projects, our ambition is to ensure that we co-produce solutions with people with lived experience. And again, what we will be doing is ensuring that that we have co-production embedded in all of our transformation policy and projects going forward. The other cogs, just on very quickly, on staff learning, a key part of this is about cultural change. It's about really ensuring that we have people with lived experience and carers at the heart of everything we do, and co-production into the training and building staff confidence. That's another cog. And then finally, the fourth cog that we have there is again around developing and people with lived experience, and ensuring developing that leadership in the sector as well, and working with voluntary community sector to develop and shape that. So that's just a very brief outline on the key aspects of how we're going to drive co-production going forward. Happy to take questions as well. Thank you.
Thank you, Cash, and thank you for your time this morning, and all the. I mean, it is exactly that, isn't it? It's empowering and energetic. Now it's time for us as politicians to listen, because we're most definitely better together. And I think, just once again, thank you, because your time is so precious. Okay, I'm just going to open it up for comments and questions. I've got Councillor Carr first. Thank you.
Thank you, Chair. This is going to be one of those instances where we won't get any scrutiny. Absolutely a fantastic initiative, and one that should be commended to other departments as well. And so hopefully the portfolio holders in the new system will take this on board and have a look at implementing something like this as well. It has to be noted that, and I blame this a lot on the media, and particularly some of the soap operas that we get at the moment, that social workers are portrayed as the enemy, and not the help that they actually are. And I think Casualty is a recent one of this, that have now got a resident social worker on the ward, and everybody seems to be terrified of him. But that isn't the case at all. But getting across with our users that we're there to help, not to hinder, is absolutely hugely important. And this is a big stride in that direction. And I just congratulate everybody that's taken part in this.
Thank you, Steve. Councillor Martin.
Yeah, thank you, Chair. Yeah, it's a great piece of work, and what a better way to learn than from people who've experienced it, especially when we're talking about, the direct payments and the independent independent payment scheme can be a myriad of complexity, talking to social workers and how to deal with that particular aspect. I do hope, because there's one thing I haven't seen in here, and that's about how carers can access respite care, because that's a very important part of their lives, their ongoing mental health and well-being. So that was the only thing that I haven't seen in there. But yeah, it's a highly commendable piece of work, and it's only enthused by the input from the carers themselves, because they're the ones that know exactly what they need, and that's exactly what we need to be reciprocating. Thank you, Chair.
Thank you. Councillor Barney?
Yeah, complete agreement with everything that's been said. I'd like to thank the three speakers. I know all of us feel exactly the same in the room here. The speaker that said they'd enjoyed the debate, thank you for saying that. It's encouraging, because I think all of us here as members do take our role seriously, and it's good to have that feedback. But I also have to say that I think for all of us in the room, and again, I shouldn't speak for everybody, but I suspect it's true, I think the highlight of our morning would have been listening to you rather than us. And I think there wasn't probably a dry eye in the house hearing you speak from your heart, and it was absolutely fantastic. And just in terms of the document, I noted it's dated April 22 to March 25. I think it's really important that this, just because it's been produced and has a date on it that runs to 25, it doesn't become a static document. It needs to be alive, it needs to keep evolving, and it needs to keep being shaped by people just like the three speakers we've had present this morning. Your input is invaluable. Thank you so much for what you're doing and your input this morning.
Thank you, Matt. Councillor Kerry?
Yes, thank you, Chairman. I was going to ask about a little bit more meat on the bones about the impacts shown on, I think, paragraph 11, but I don't think there's any need to do that. And I think the speakers here today have shown their passion, their hard work, and in making this happen. And I'm sure they will make this happen. Follow up from the input they've had in producing this report, and I think it's fantastic. And thank you very much.
Thank you.
I think it's really good for the future of Nottinghamshire and the city. Thank you.
Councillor Pringle?
Thank you, Chairman. Just to applaud all the speakers this morning, as has been said across the chamber. The important thing for me with this document is that your voice is heard continually, and Cash, I'm holding to you account to make sure that continues with these people. And if there's changes to be recognised, that they are replaced, because your voice, the lady, was it Margaret? I can't think who it was now. Margaret, was it? Marion said how she enjoyed the debate this morning from politicians. Well, Marion, we work for you, so it's important that we're your conduit to get anything in place that we can and support you where we can. So I really think that this is an excellent piece of work, compounded by obviously talking to the right people who can direct us and allow us to learn their situations. And I think that's going to be vital in moving forward. Thank you, Chair.
Councillor Henshaw?
Thanks, Chair. I too concur and thank the participants for their heartfelt contributions. It's part of the strategy, obviously, to listen to people, and the old adage, you've got two ears and one mouth, so it's very often good to listen and formulate your responses from actually listening to people, putting people that use the services right at the centre of what we do. Person-centred planning, person-centred approach to care. These are all laudable ways of moving forward, but the co-production better together, it's one step. We need to be moving on. We need to be looking at things in the future. We need to be using this as a base for developing things and for putting people right at the heart of what we do. And obviously, it's very interesting to read, and it's a great report. So we'll be supporting it. Thanks, Chair.
Thank you. As we said, it's a living document. It's there for 5 years. It's not going to go dusty on the shelf. It's available for everyone. You can share it in your communities. I just get it out there because it is amazing. And just before we move to the vote, just once again say thank you for your time this morning and for all your hard work that's gone into producing this. Thank you. We will now move to the vote on the recommendations set out in the report. All those in favour? That's unanimous. Thank you very much. Thank you.
Thank you. Thank you.
Thank you.
Take care. You can listen to the last bit if you want. More than welcome.
Thank you.
He's gone. See you, Ed. Take care. Thank you. Okay. Agenda item 8. Proposed increase in fees for independent sector adult social care providers, direct payments and other charges. This report seeks approval of the proposed distribution of £14.966 million to independent sector care and support providers across the different adult social care services. At full council on the 24th of February 2022, members approved the allocation of this sum to meet provider cost pressures arising from the impact of the national living wage, increase in employers' national insurance and fair price for care inflation for 2022-2023. Nottinghamshire County Council has had a proactive approach to ensuring that it pays its providers a fair price for care, to ensure that we have a sustainable social care market of services across the county, both for people whose care the council funds and also for people that fund their own care. I move the recommendations of the report as set out on page 9.
And I'll second those, Chairman.
Thank you very much, Councillor Barney. I'll now hand over to Gemma. Welcome.
Thank you.
Always a
Thank
pleasure.
You. No problem. Thank you, Councillor Elliott. As introduced, thank you, Councillor Elliott. The report is seeking approval for our annual increase to the rates we pay our external providers, and as the report states, it's for our home care home, and other providers. As the report states, we've got a responsibility under the Care Act to make sure we've got a sustainable market, and also to ensure that providers are able to pay their minimum obligation in relation to statutory pay. As introduced again, the report always outlines the fees have been uplifted as per the increase to the national living wage. So I will leave it there because I think it's been introduced and also I've outlined. So if there's any questions.
Any questions? Councillor Carr.
Yes, thank you, Chair. We'll support this today because it's a good thing that national living wage is going up to £9.50 an hour. Although it should be noted that if somebody's working 35 hours a week on the national living wage, will now be paying income tax and national insurance out of their salary on minimum wage. But that's nothing to do with this council, but it should be noted. But I am disappointed that a political decision was made to increase national insurance rather than income tax. And this is having an impact on this council. At the budget meeting, Richard Councillor Jackson stated that the effect of increasing national insurance would be minimal. But here we are, having to contribute almost 20% of the recent rise in the social care precept to national living wage and national insurance contribution rises. And that just isn't fair. It talks here of a 1.25% increase in national insurance contributions. It isn't. It's 1.25 percentage points. The actual increase is 10% from what it was originally. And I find this very, very disconcerting in that not only are working people in this county who earn more than £840 a month having to have their national insurance contributions increase, which will probably negate all of the council tax rebate that they're about to get, but also that those who are working and paying council tax are having to pay towards the employer's national insurance contribution in a rise in council tax precept. Now, this was an absolutely ridiculous situation and has put councils and has put carers and many industries
at risk, at financial risk in a very difficult period. I don't expect the officers to comment on the political content of this, but it is disappointing that we've had to contribute some of the social care precept, which should be going to services, to paying the Chancellor of the Exchequer an extra amount of money towards the National Insurance Employers contribution, and I think that's very disturbing. It could have been done very easily and a lot more fairly by income tax, but we chose to go another route. Thank you.
Councillor Angel.
I don't think we've much choice, Chair, but to support the recommendations in the report, bearing in mind everything that Councillor Carr said, because even uplifting the living wage to £9.50 an hour for the work that care workers do, I think is still a travesty, and for the amount of responsibility and work that people in homes and care settings get, they're worth far more than £9.50 an hour. And until, it's my own particular view, until you or we as a society address the issue of low wages in care work and value them for what they do, then I think we will have a continuing problem. But in saying that, the issues in relation to the amount of money we pay to providers for the services that they provide and support, I just wonder whether or not there will be an ongoing issue about the levels of remuneration we pay in relation to the number of care homes that are financially struggling at the moment. And we all know that, and it's been mentioned earlier on in the meeting, that there are some care homes that are actually struggling, and whether or not we look at the amount of money we pay to care homes, it says it's fair. I don't disagree with it being called that, but I think at some point in the future we have to look at the monies that we pay. But in relation to this report, I think we have no choice but to support it.
Thank you. I'll take Councillor Creamer's question or comment.
Yes, thank you, Chair. Yeah, again, just one comment and one question. Yeah, we have to support it. It is the right thing to do. They do need the uplift. And as has already been said by Councillor Carr, it didn't need to be quite the way it is. It could have been more beneficial to the actual recipients. The question is on item 28 on sleep provision. Where is that just our staff? Or are we going to expect the actual the companies that hire our carers? Are we actually going to expect them to pay that as well, or is that just for our staff? So it's clarification on paragraph 38.
38, sorry. Is it 28? I was got confused. Gemma?
Yeah, okay.
Yeah, okay.
So I was reading 28. I was just catching up. Apologies.
Yeah, I looked at 28. Yeah, I think you did say 28. But then you said 38.
It's the sleeping provisions.
Yeah.
Sleeping provisions in 38.
Yeah. It's with our internal staff. Obviously, we've got our own rates that we pay our staff, so obviously that will be increased in line with the national living wage. So obviously we've got our own pay scales and pay bands for our internal, so obviously that will be increased to match the rates. But I think our rates are slightly different within the council anyway in terms of our scales of pay anyway. So yeah.
Okay. Thank you.
The question, just for clarification, was: will we be expecting our contractors to up theirs as well?
Saying I'm having the troubles too. Yeah, apologies. Yes, we will expect that, and my team will be doing that as part of our contract management to make sure that the rates have increased.
Councillor Pringle.
Yeah, sorry, just in response to being able to follow on what our suppliers are paying. I understood from both the budget and budget meetings that we had no control over what was paid within our care providers. Now, I really hope I'm wrong and I've completely misread the last 10 years, and that now we are in a position to challenge, because I think it's important that for the provision that we're talking about generally here, that provision is shared across the carers themselves, and they're recognised generally. So,
hand over to the corporate director, Melanie. Thank you.
So just to confirm why it's difficult to control rates of pay in the sector. So within our own contracts, part of the contracts that Gemma's team manage for us, we're very clear about our expectations about pay, terms and conditions, including travel time and the terms of employment. But it's just to remember that we only buy a part of the adult social care market. So the NHS buys around 20% of the market, which is why Cash has done that paper earlier about joining up. We buy about 40% and the rest of the market people buy themselves. So we only have direct control over part of that employment of the care workers. So that sort of 22,000 I mentioned, some of those are directly employed. So that's why it's quite difficult in us saying that we can guarantee the pay of the social care workforce. But we certainly have written into our contracts some contractual conditions about the bits of the market that we buy ourselves. So I know it's quite complicated, Mike, but hopefully that helps.
Yep. Can I just come back, because I absolutely understand, and I know I wasn't being flippant. I know it's really difficult, but if we are serious about being top of the tree, and I'm not happy to not be, Cash, so if we're serious about being top of the tree, I think that engagement is something that we have to have with all of our carers. So I'm looking for somebody to come up with a route that makes it easy to understand and to be able to deliver a balanced pay structure and support for all carers, in which case hopefully we'll be able to increase the demand that we now face for carers actually on the floor. I'm looking for a magic wand, I know I am.
A silver bullet, which is... We'll leave it for Gemma. No.
Yes, Gemma. It's really difficult, and we do engage through obviously our contract providers, but also through our support with direct payment providers, those who provide people who provide privately provide. So there are offers out there, but it is that engagement. It is really difficult.
Okay. Got Councillor Martin, then we'll move to the vote. Thank you.
Yeah, thank you, Chair. Yeah. Apart from saying that I agree with everything that Councillor Carr and Councillor Henshaw said about national insurance increases without going too far into it, you know, there are other things that the government could do to help us with, like VAT on fuel and domestic fuel. As we move towards the integrated care system, surely that issue that we're talking about over the increase of pay, because you've just said that we contract 40% and the NHS contract 20%. So therefore, once we move towards the integrated care system, we are then currently contracting mutually 60% plus. So we should have more of a forum for insisting that the costs are carried through to the private contractors. Would that be, that's my understanding of the integrated care system and how it should progress going forward, because there must be some forum of nursing homes that you're going to be integrated into that body or speaking with on a regular basis. You could explain on that one. Thanks.
Cash.
That's exactly the ambition. You know, the working and integrating with ICS and health enables us to maximise our purchasing power and use that as a leverage to shape and develop the market and ensure there's consistency across the board around pay and terms and conditions. And again, that increases to say around 60%, and that's very much our ambitious to work with health, and again the post that I described earlier on is a starting point. It's a journey. We've got to build relationships and trust with our partners on both ways in order to develop that strategic approach. So very much support that approach that you've described as well.
I'm just gonna let Gemma come back. Gemma just wanted to.
I just wanted to add, Councillor Martin, as much as obviously going forward we're going to be even more integrated. Prior to COVID and even during COVID, there was a lot of joined up work with us and our colleagues in the CCG, and we very often have regular forums with our providers. Whilst the discussions are about care provision, we generally don't go into sort of contractual or funding in those kind of forums. We are very joined up and actually present those forums as a collective. So that's something we're going to build on more, but we are already at that point where we're doing a lot of things together already. Thank you.
Paul, just quickly then.
Just
Yeah.
to, perhaps I framed my question not accurately enough for the officers to remember. It's in relation to the proposed fees to care homes, because I actually asked. Obviously, we've got to increase, but have we increased them enough to prevent the problems in care homes, i.e. the situation where some care homes are not being financially viable, so therefore they have to close, and then because they close, then we have to pick up the shortfall. It's just a question around, I don't suppose we'll always pay enough, but it's just in relation to these fees. Do you think that the increase in fees will mitigate the problems that could come?
I believe it was partially answered earlier when we talked about the social care reform. Okay, yeah. So, yeah, well, the social care, okay, the reform. Yep.
Yeah. So the social care market, both people working within it and the providers themselves, has been significantly impacted by both economic forces, labour market forces, and the whole thing about working in COVID, which is a context that some of it's inside of our control, some of it's outside. We're responding to, and that uncertainty because of recent events, I think, is going to be progressing. So whether I can say that these increases are going to mitigate all of those risks, no, I can't. So it represents some inflationary uplift that's within the contract and some extra money that we invested. So we didn't have to pass on some of that national insurance cost, employer NI, but we did. We chose the council. We chose to make that decision. The piece of work that I think will start to get under that financial sustainability is that work we're doing under social care reform. So that's the bit of work we're doing into next financial year, is trying to work out what is a sustainable rate of pay, and that bit about equalising, which is the government's intention, equalising between self-funders and the market. But it is a complicated piece, and because there's so much uncertainty, no, I couldn't say that this is going to mitigate all those pressures.
Okay, thank you. And with that excellent explanation, we'll now move to the vote on the recommendations. All those in favour? Unanimous all morning. That's amazing. Thank you. The work programme, agenda item 9. The recommendation of the report as set out on page 102 of the agenda pack is that committee considers whether any amendments are required to the work programme. I formally move the recommendation.
I'll second that, Chairman.
Thank you, Councillor Carr.
Yes, Chair. There was a report on East Midlands today last week of a care worker. I don't think she was from Nottinghamshire, who travels from home to home, and because of the rate of increase in petrol prices, which can be anywhere now between 159 to 170 plus per litre, her mileage allowance was nowhere near covering the cost of petrol from going from one house to another because she used her own car. Can I ask that we have a report, possibly because it's an urgent matter, as to how the petrol prices are affecting our staff who use their own vehicles for work?
Yeah. No, we couldn't. We'll take advice from the Finance Committee. Okay. Councillor Henshaw.
Thanks, Chair. Looking at the obviously the work programme, I'm waiting with bated breath for the day opportunity strategy, which I'm looking forward to receiving. I did mention last year, and I know it was sort of a problem in relation to visiting day services because of the COVID thing. Are the day services now available for any member that's interested to visit to see what's actually going off? Thank you.
Can we sort?
So our day services, we have we reopened the day services last year, but we have had ongoing restrictions in terms of some of the guidance that we've had to continue to follow. We are fully reopening in the next few weeks. So absolutely happy for people to visit if they've got an interest in coming. However, they might still find that there is mask wearing, social distancing, etc., because we do have very vulnerable people to protect.
Okay, with that final agenda item moved and seconded, I'd like to thank councillors and officers for attending this morning. And did we vote? All in favour of the work? I thought we did. Unanimous again. Okay. So with that, moved and seconded and unanimous. Okay. I thank councillors and officers for attending and formally close the meeting. Enjoy the rest of your Monday.